Tonight in Medical Rounds, he was a pitcher for the New York Mets, and news of Tom Seaver's death last month put a spotlight on the condition known as Lewy Body Dementia. A newly released documentary on Robin Williams revealed the comedian also suffered from the disease in his final days. Joining us now is Dr. Jeffrey Lahrmann, a movement disorder specialist with Chase Family Movement Disorders Center. Doctor, thank you so much for being with us.
Hi, thanks for having me on.
So first off, due to current events, we've heard a lot recently about Lewy body dementia. Can you explain to people what exactly this is?
Sure, yes. So I actually like to refer to as dementia with Lewy bodies as a specific disease, and it is actually the second most common degenerative dementia, secondary to Alzheimer's disease. And it's considered a neurodegenerative disease that is similar to Parkinson's disease, but is much more complicated. There's been an increased awareness of Lewy body dementia or dementia with Lewy bodies with recent celebrity acknowledgement of having the disease, including, as you mentioned, Tom Seaver, but also comedian Robin Williams, actress Estelle Getty, baseball players, not just Tom Seaver, but even Bill Buckner and Andy Carey. There are even more people, but just those are the most recent within the past decade, and it's definitely brought it to more people's attentions.
What are the symptoms of this disease, or what should people be looking out for?
So people with dementia with Lewy bodies can have basically similar symptoms to Parkinson's disease, like tremors, muscle stiffness, slowness of movement, or even gait issues. And they typically, though, also have memory issues. They may even have confusion or visual hallucinations and delusions. The typical Parkinson's symptoms, though, associated with dementia with Lewy bodies are more mild compared to those with Parkinson's disease. People with Lewy body dementia oftentimes present with the dementia aspect, let's say, even before the motor symptoms or 1 to 2 years after the onset of motor symptoms in comparison to Parkinson's disease, which they would have motor symptoms for 10 to 11 years before the onset of dementia.
What kinds of treatments are available for Lewy body dementia?
There are multiple medications that we as neurologists use, and it's mainly to address different components of the dementia with Lewy bodies, whether it be the cognitive and behavioral symptoms, the dementia-related psychosis, and or the movement symptoms if present. Also, a significant component to treatment and therapy is the benefit of exercise and physical activity. There's been multiple studies providing long-term benefits for this disease and other Parkinsonian syndromes just by simply exercising and keeping an active lifestyle. So we try to promote that regular exercise and activity as a part of a treatment plan as well.
All right, a lot of information there. Thank you so much, Dr. Lahrmann, for joining us. We certainly appreciate it.
Oh, no problem. Thanks for having me on.
And for more information, you can head to the website you see right there on your screen.